Hello, this is Pradnya Kulkarni, and in this session we will discuss client-centered approach to counseling. In the previous lecture we learned about psychoanalytic approach. This approach conceptualizes social and emotional problems as deep-rooted in childhood and determined by unconscious dynamics. As a reaction against this deterministic approach, Carl Rogers proposed humanistic approach in 1950s. It focuses on a very constructive and positive side of human nature. It assumes that human beings are capable of making constructive changes and live effective and productive life. The basic assumption that the counselor knows the best was challenged by this approach. In contrast to authoritarian position of the counselor, Rogers proposed the non-directive role of counselor to facilitate clients' growth. In the practice of this approach, counselee is at the center of the therapy. Counselee is termed as a client rather than the patient, and the client holds relationship of equality with the therapist. Thus, this therapy is known as client-centered or person-centered therapy. Let us begin with key concepts of this approach. Carl Rogers believed that every individual has a basic tendency and striving to actualize, maintain and enhance. He termed it as self-actualizing tendency. For example, human infants strive to achieve further milestones in the development like standing, walking, learning language and different skills from the environment. Students strive for higher and higher academic achievement. Workman strives for career development. Overall, we humans strive for better health, better quality of life and higher integration with ourselves and the environment. In brief, we continuously strive for our best possibilities, which are known as self-actualizing tendency. Self-actualization is an important concept in the counseling context since it underlies the idea that clients have this inner tendency to deal effectively with their problems and move forward. Central to Rogers' theory is the notion of self-concept. This is defined as organized, consistent set of perceptions and beliefs about oneself. It consists of all the ideas, values that characterize I and me and includes perception and valuing of what I am and what I can do. Let us do one quick self work exercise related to this concept. Write down 5 adjectives or qualities that you feel are the most suitable to you. I hope you could write adjectives and qualities most appropriate to you. So, these adjectives constitute your self concept. This self concept is central component of our total experience. It influences both our perception of the world and our perception of ourselves. For instance, a student who perceives herself as intelligent may behave confidently in the classroom, take initiative in the class activities and answer questions. Whereas student who has self concept as he is poor in studies will avoid doing homework, will be anxious when asked to answer questions in the class. Thus, our self concept determines our social behavior, emotional reactions and overall adjustment to the environment. How do we acquire this self concept? Let us try to understand with the help of this case study. Devi is a quiet 8-year-old child. Her mother and father often tell her that how they are proud of her because she is not like a naughty children who live and play near her home. So, Devi tries hard to be well behaved and quiet all the time. Now, in this case, Devi has developed the self concept of well behaved girl because her parents appreciate her for not being naughty and being quiet. Thus, significant others' expectations and evaluation color our self perception. Let us discuss how this development of self takes place. In most social situations, love, approval and affection are on condition. That is, if you achieve good marks, then only you are a good student. If you help in household tasks, then only you are a good daughter. Rogers used the phrase conditional positive regard for this. This conditional positive regard leads to the development of condition of worth. As Devi's parents give positive regard to her only when she is quiet and well behaved, then well behaved becomes a condition of worth for her. For a student, achieving good marks becomes a condition of worth. Many times in fulfilling these conditions of worth, person moves away from their true nature. Rogers has distinguished between two concepts, true self and ideal self. The true self is actualizing nature of the person. For example, in Devi's case, she is 7-year-old child. So, fun seeking tendency is her true nature, whereas ideal self develops due to the inculcation of condition of worth. Devi's ideal self is well behaved and has developed due to condition of worth imposed by parents. Rogers says that this gap between the true self and ideal self leads to the state of incongruence. When client comes for the counseling, he or she is in the state of incongruence. The counselor has to understand this. Here are few more examples of incongruence. Vrushali is a senior engineer working in the multinational company. She finds her job quite boring. However, from childhood she has been appreciated as a creative dancer and now she is confused about her career. See this second case. Shlok is an adolescent boy who is very anxious in social situations, especially when girls are around. And this is because he feels that he looks very unattractive and boring to his peers. See this third case. Swapna is a newly married young lady. She loses her temper frequently as her in-laws do not appreciate her for cooking. In these examples, emotions like boredom, anxiety and anger outburst indicate state of incongruence. That is, there is a wide gap between the true self and the ideal self of these individuals. Thus, maladaptation is nothing but the state of incongruence according to client-centered approach. And the focus of counseling is to reduce this gap and bring a state of congruence. What is the therapeutic goal of client-centered approach? The goal of client-centered approach is not merely to solve problem. Instead, it is to assist the client in their growth process to better cope with problems. Therapists function as stated by client-centered approach. Therapists themselves work as an instrument to bring change in the client. Therapists create therapeutic climate that will enable the client to engage in a meaningful self-exploration. When people are free, they are able to find their ways, reduce the state of incongruence and facilitate growth. So, therapist attitude of genuine caring, respect, understanding can loosen client's defense and rigid perceptions and move to higher level of functioning. So, client-centered therapist does not intend to diagnose, create treatment, plan, strategize, employ treatment techniques. Generally, therapists do not take case history, avoid leading and probing questions, interpret client's behavior or evaluate client's ideas and plans. But emphasis is on creating psychological climate to facilitate client's growth. So, let us recap the concept that we have learned so far about Rogers' client-centered approach. First, we learned about the self-actualization tendency, a fundamental urge of a human being to grow and enhance their potentials. Second, we learned how self-concept develops and condition of worth set by significant others lead to state of incongruence. Finally, we also discussed the goal of counseling and the function of counselor according to Rogers. other important aspects of this therapy we will discuss in the next session. Thank you.